Hi, everyone, and thank you for sharing time with us today. I'm Amy Hewitt, Executive Director of the Scleroderma Research Foundation. So today we're webcasting from our offices in San Francisco with our guest presenter joining us from Actelion Pharmaceuticals. This is the 6th webinar in our series. I encourage you to visit our site and browse previous presentations. You can see them all at sclerodermaresearch.org. As we've often said, it's important to us that we deliver the content you want, so please speak up. Share your thoughts by sending a comment via email or calling our offices. The more feedback you provide, the more useful our site and programs become for everyone in the scleroderma community. And of course, we also appreciate your support. The Scleroderma Research Foundation is America's leading nonprofit investor in medical research aimed at improved therapies and a cure. Still, we are entirely dependent upon charitable gifts. This webinar is offered to you at no cost. We do not charge membership fees and receive no government funding. We hope you will consider making a donation after our time together so that we can continue our progress. Today's webinar will focus on ways to cope with scleroderma and how patients can better manage the emotional stresses of their disease. Specifically, Nurse Liddicoat's presentation will explore losses experienced by those challenged with chronic medical conditions like scleroderma. She will outline the 5 stages of grief and provide helpful coping mechanisms for each. So we are scheduled for 1 hour, and within that time, we will include a question and answer period. As a reminder, questions can be asked by using the chat box in the conference window. Please remember that our webinars are for general information only, and no information provided is to be considered personalized medical advice. So that being said, we will not be able to answer questions pertaining to personal symptoms. Scleroderma affects everyone differently, and it's important that patients seek care from a licensed rheumatologist or other specialists. It's great to have you with us, and now my pleasure to introduce today's speaker. Megan Liddicoat is a registered nurse in Actelion Pharmaceuticals clinical educator. She has more than a decade of experience in nursing, including positions in the Neonatal Intensive Care Unit at Children's Hospital, a research nurse at the University of Colorado Pulmonary Hypertension Center, and her current position with Actelion, focusing on clinical education specific to pulmonary arterial hypertension, also known as PAH, and the psychosocial impacts of the disease. So we'd like to welcome her today to present Grief to Hope, From Loss to Healing. Thank you for being with us today, Megan.
Thanks, Amy. I appreciate it. Okay, so just to kind of do a few housekeeping things, if everybody wouldn't mind just writing down a few things as we go through this, I would love to take questions at the end, but I'd also like to hear your comments and your own stories and ways you've dealt with the grieving process of learning that you have a chronic illness. So please jot those down and feel free to share those at the end. Today what we're going to talk about is coping with loss, specifically that comes with chronic illness. We'll review the entire grieving process, and I'll explain in just a minute what that is. So let's go ahead and get started. Okay, so just a brief overview. We're going to talk about losses that specifically come with chronic illness. Then we'll define actually what grief is and go over the 5 stages of grief. And then finally, we're going to see the light at the end of the tunnel by going through healing that can be accomplished with hope. Okay, so the diagnosis of an illness is stressful news that brings incredible challenges, and I don't think that's probably news to anybody that's on the phone today. These challenges can include loss of physical abilities, the loss of dreams, loss of hopes for the future, loss basically of life as you have known it. For many, it may have taken months to even years to become accurately diagnosed, and there may have even been some sort of a sense of relief when you heard that the doctor had finally identified what this was that you had. But then as that kind of wears off and you begin to really understand what you have and that this is not something that's likely going to go away in your lifetime, the grieving process actually starts to begin. So what is grief? Grief is defined as an emotional reaction or a way to cope with a loss. That's simple. But oftentimes we don't think of chronic illness as a loss. When we give this presentation, I think a lot of the time people coming to hear it are thinking of loss as the loss of their life, of passing away and no longer being here. But there is loss of life in just dealing with the chronic illness day in and day out, actually living with the chronic illness. And we understand that. Trying to cope with a chronic illness can create a storm of emotions, both for the patients themselves, for the caregivers, children in a family, other family members that are maybe close to you, friends, acquaintances, your job and the people that you work with, anybody that the person with the disease is close to this can affect. Your adjustment to these changes is not only important, therefore, to your own emotional well-being, but to your overall life balance. So let's talk just briefly more about that. So how do we grieve? Well, research actually shows that people who actively grieve their diagnosis do a lot better than people who suppress it, repress it, deny that it exists, deny the feelings of grief. Loss, change, and grief are a part of our lives, not just chronic illness, but we all go through a lot of changes. That's life itself. But oftentimes our life plan doesn't include these issues when we're young. So we're unprepared to deal with this unexpected and unwelcome news when it comes to be, and we don't know how to take it and where to put our first step forward. Information about grief and loss, hopefully, during this presentation will help you to recognize your own emotions and to put that first step forward and move in a positive direction. Understanding these emotions can really help to ease some of the stress that we feel. And it can help us to really get to that hope, which is the healing that we need to have. Okay, so now let's actually go into the 5 stages of grief. And you all may have heard of these at some point in your past, but never really thought about them again. So just to review, the 5 stages of grief are denial, anger, bargaining, depression, and acceptance. Now, each person is unique. Some people may not experience all of these stages. Some people may skip a stage or go through a stage more than one time, but just understanding these stages will hopefully allow you to explore and accept what you're feeling, regardless of how you move through these. These emotions actually exist in a positive light to allow us time to adjust to and cope with the illness that we're dealing with. If we were to experience these emotions all at once, we might just become completely and totally overwhelmed. And that does happen in some cases, but our hope is that by helping you to understand the 5 stages, you can realize what you are feeling in the moment and move through that into another stage versus trying to take them all on at once. So let's talk a little bit more about those. Okay, so the first one, denial. Denial or disbelief is another way of putting this one. Denying the illness or the loss, it's unconscious. It's a defense mechanism. It's used to keep the change, the event from becoming overwhelming. It kind of gives you a chance to really comprehend what's going on. It's usually a temporary stage, but that's not always the case. What questions came to you when you were first diagnosed? Think about that as a patient, as a caregiver, as a family member. What thoughts did you have when you first heard the news? What did others around you, what were their reactions? These are some commonly asked questions by patients, caregivers, and sometimes what other people will say to you as well. Is this really true? How can this happen to me? Maybe I've always been a healthy person. I've never done anything that should cause me to be ill. What is this disease? I've never heard of this before. Nobody I know has this. Maybe my doctor didn't even know what this was. What is this disease? And others may say, and we'll go into the next stage here in a second, but you look so good. You don't look sick, which can also cause the anger stage that, like I said, we'll talk about. Now, when we go through these stages, there are both positive and negative ways of going through these stages. So let's talk a little bit about that. Coping negatively with the denial stage. What does that look like? You may avoid your doctor, your healthcare team, not show up for your appointments. You don't want to hear any more bad news. You're just not going to go. Resisting your doctor's treatment plan, your therapy plan that they think they'd like you to follow to treat this disease. You're just not going to take the medicine. It's too cumbersome. It's not doing anything for you. You've been told it's a chronic illness. I'm not going to treat this at all. Isolating yourself from others is very, very common. You're just going to shut yourself up in your house and not talk to anybody else and just pretend that it doesn't exist. Now, if this is the way that you handle it, the denial stage can go on for way too long. It can last for weeks or months, and in some cases even years, which is not productive at all. You may, like I said, do nothing at all Just avoid the whole idea of the illness, or even do the opposite and put too much on your plate. Take on extra responsibilities. If you're too busy, you can't think about it. That's not a positive way of coping. That is a negative way of coping. So how do we positively cope when we're in the denial stage? Education is power. Learn about the disease and the treatment plans. Talk with your healthcare team, your doctor, your nurse, your medical assistant. Work through organizations that deal with scleroderma to get more information. I definitely would advise you to take care when looking on the internet and make sure that your sources of information are accurate, reliable sources, because we all know there's a lot out there that isn't necessarily true on the internet. Seek support. Ask loved ones to learn with you. Even if it's somebody that knows nothing else about scleroderma, just having a buddy can be really helpful. Share your feelings, and this could be in the form of talking with somebody. This could also be journaling. Both you and your caregivers can move towards acceptance a lot better if you get your feelings out. And sometimes those conversations may seem anger-provoking, but it's really something that needs to be worked through if you're going to be able to take the step forward. Make sure to ask your questions of your healthcare team. I know I've often heard, well, I go in and I just have 100 questions and my doctor doesn't have time for that. Well, then categorize them. Try to find common themes and figure out 3 maybe top questions that you definitely want to get answered from your healthcare provider. But also remember that they are a provider. They are there to serve you, to treat you. So you have every right to ask questions and to get those questions answered. So don't hesitate to ask questions in that respect. And keep life changes small. This is not the time to take on new responsibilities. If anything, maybe giving away some responsibilities could help give you some more time to really figure this out and figure out what your next step is forward. So unloading your plate is actually a better way to go here. Okay, so now let's move into anger. Anger is the second stage of grief, and it's a normal emotion of grief. It's a normal emotion of life. I think that anger is often looked at very negatively as a bad quality, and every person that walks the earth has anger moments, and it is normal. It may come from your life being interrupted or limited because you're all of a sudden sick and can't do the things that you used to like to do. Anger is another stage of grief that can really interrupt your life. It's kind of a more complicated form of frustration. You just feel out of control, and how do you get that control back? And if you're a caregiver, you're also going to be in the anger stage. Sometimes we see role reversals with anger. So the person who used to be the caregiver is now the patient, and vice versa. And those are hard roles to take over, especially if you were the head of the household, woman of the house, took care of everything, and now you're dependent on your husband, or husband was the breadwinner, and now his wife is going to have to take over some of those responsibilities. So anger is very natural if you think of it in that sense. So then how do we negatively cope and positively cope with anger? You may try to repress your anger, which leads to blow-ups. You can become bitter, irritable, and this just furthers that feeling of loss of control. You might affect relationships with others by lashing out unpredictably at people that it really has nothing to do with why you're really angry, but you're just trying to get it out. Examples, let's see, of negative coping. Somebody who's healthy complains about maybe a minor health problem that they're having, and you blow up telling them that their trials are so incredibly minor compared to what you're going through. Or sometimes this is directed at healthcare providers. I've definitely experienced this and completely understand it. But a nurse, asks you to reschedule an appointment due to some conflict, and you blow up and say, I'm the one who's sick here. I'm tired and exhausted and can't get out of bed, and you keep rescheduling on me. Those are just some examples. Maybe you have thought of some while we've been talking about this as well and want to jot them down and share at the end. Now, there is positive ways, though, to cope with anger. Recognizing that you're angry is the first step, okay? accepting that it's normal, that it's okay to be angry. Of course you would. Who wouldn't feel angry with such a diagnosis? And then clearly communicating your needs to others. Take some deep breaths and let the nurse know on the phone that, you are really not feeling well. Maybe you need some rides into the office, and the person who brings you can't bring you on the day that they've rescheduled. Let your healthy friend know that you understand that they're dealing with some health issues, and those must be really frustrating, but you've just got too much on your plate health-wise to really focus on their concerns at this time. And learn to talk about your condition. Learn to explain to people what scleroderma is, and maybe just a couple of sentences. Okay, so now let's look into bargaining. The third stage, bargaining, it allows us time to move from one stage to another. It gives us time to change and to adjust to this new life. It allows us time to try and make sense of the occurrence of this illness. We may go back in time to review how we could have prevented the illness, or we may start to make bargains as far as what's going to happen in the future. So some common questions and statements. What if I had exercised more? What if I had never smoked? What if I ran 5 miles a day? If I had eaten better, I may not have gotten this disease. If I had just gone to the doctor the first time I noticed that my fingers were turning purple, then we could have caught it earlier. If I start to do this, then the disease will go away, and so on and so forth. And generally, none of those are actually going to work. So some examples of negative coping in the bargaining stage. Continuing to constantly search for answers and not move to this is what I have. This is where we are today. How are we going to move forward? Giving up quickly on treatments and therapies that your doctor has asked you to adhere to. Looking kind of for the quick cure. There is absolutely nothing wrong to looking into non-therapy type treatments, herbal treatments, things like that. Of course, having your doctor involved in all of that and letting them know what you're looking into. But definitely don't go after that as a quick cure. If it was a quick cure, we probably would have found it by now, and a lot of times you've given up on something that may have worked a little bit better because you just want it fixed right now. And ultimately, you become exhausted, physically and emotionally from spending too much time in this stage. You're constantly trying to bargain and you're not getting anywhere. Of course, that would be exhausting. Now, but there are ways to positively cope. Set aside frequent periods to rest. Like I said, empty that plate. Get rid of some responsibilities if possible. Give yourself, 15 minutes, 10 minutes, a couple times a day to just sit back, relax, no noise, and just rest. Let your mind rest. Keeping close communication with your healthcare provider, whether that's the doctor, nurse, medical assistant, somebody else within the office. Keep in close communication with them and just let them know how you're feeling. Ask questions about your treatment and your therapy that's been prescribed. You have every right, once again, to ask those questions and to fully understand what it is that your doctor is asking you to do. And then stick with your therapy. Give it a chance to work. And if you feel that it isn't, again, go back and communicate that with your doctor before you just give up completely. And then the next thing that I would really encourage is if you are able to find a support group to share information with others, to bring you out of that isolation. Scleroderma is incredibly rare, as we know, and so it's really hard to find somebody that knows exactly what you're going through. I would encourage you to seek out support groups, and if there isn't a support group in your area, it doesn't take a whole lot to pull a couple of people together and start one up. So definitely consider that. Okay. The next stage. My slides are a little slow here. There we go. Okay, depression. So experiencing a loss or life-changing event can lead to reactive depression, and there is a difference between reactive depression and chronic depression. Of course, anybody who would get this diagnosis would be depressed, even just if it was for only a day. This is a huge change, a huge undertaking. It's completely normal. It's a normal stage of the grieving process. It's normal when learning of a chronic illness. But the problem is staying in this stage too long. You move from reactive depression to chronic depression, which needs to be treated and needs to be treated quickly. Now, the positive part of depression is this actually may be a signal that we're almost to the last stage, which is acceptance. So try to look at it as that as well, if you happen to be in this stage right now. Initially, when you're depressed, the need for change is pretty pressing, and you might begin to feel a little bit overwhelmed. So coping negatively with this, notice that you may begin to isolate yourself. You move into feelings of sadness and find that you just can't move forward. Some specific symptoms: sadness, loss of interest or pleasure, or withdrawing from activities, not because you can't do them anymore, but because you just, you just don't want to. That's kind of how you feel. Feelings of guilt that you brought this on yourself, of low self-worth. Disturbed sleep or disturbed appetite, that could be not sleeping enough or sleeping too much. And the same with appetite, that could mean eating too much or not eating enough. Low energy, poor concentration, and mind you, I know that there can be disturbed sleep and disturbed appetite, with scleroderma, but these are outside of that spectrum. It's come up, you've learned you have the disease, and you've noticed that, you have this overall mundane feeling. If this is how you're feeling, it's really important that you do seek professional help. And that is not a sign of weakness. That is a sign of strength, that when you notice that these are feelings that are just not going away, that more often than not you are feeling sad, you do need to seek help. Okay, well, my slides are slow here and I'm waiting. I'm going to say, I honestly would encourage anybody, especially if you're able to get it paid for through insurance of some sort, to do therapy, to talk with somebody. It's a wonderful opportunity to have a third party that's not intimately involved like a friend or family member is, to just talk through how you're feeling and how you're going to move forward, even if you're not in this depression stage. But after learning of the chronic illness, like I said, look into therapy. It's never seems to be a bad idea from what I've seen. Okay, so negatively coping with depression, we talked about a little bit. Positive coping methods include, again, recognizing that you are indeed depressed, seeking help and treatment. Practicing a healthy lifestyle can really bring up your mood. Eating correctly, exercising. For some people, just go into your bedroom and shut your door and have a good cry, and when it's over, you feel incredibly better. Journaling is also a real healthy way of getting out your emotions. We actually have an entire slide deck that just talks about journaling and the benefits of that. And that doesn't entail necessarily going out and buying a specific journal or a diary of some sort. You certainly can do that, but it may be just jotting down some feelings on a piece of scrap paper and then crumpling it up and throwing it away at the end of the day. Just getting it out is the main point there. Practice or stay in touch with your support systems. Like I mentioned, the support groups. Even if you can just find one other person that maybe you can get on the phone and talk with that has scleroderma, sometimes it helps to just have somebody else that can understand what you're going through. And continue to participate in the activities that you do enjoy, and find other activities that maybe you haven't ever done but you'd like to. It's an opportunity to maybe try something new. Okay, and the final stage, the stage that we all want to get to, is acceptance. It's the goal of the grieving process, to come to this accepting your new reality, whatever that may be. You aren't necessarily going to be happy about your diagnosis or the life-changing event that you've just undergone, but you can learn to move forward in spite of it. Acceptance finds you acknowledging the changes and moving towards altering and adjusting your life. Acceptance is a shift that focuses on how to live, and I would say live in capital letters, with the illness while not being defined by it. So you're not just a patient, you're not just a disease. you are so-and-so who happens to have this disease. It's often a more positive way of looking at it. In this stage, you begin to look forward rather than backwards in time. There may be new life goals adjusted to give you a sense of purpose in the confines of this new reality that you're dealing with. Acceptance can actually be empowering. It can increase your sense of control, that you have your life back in your hands, and you've just got some new challenges that you're gonna completely overcome and succeed at. Things to consider in the acceptance stage and ways to get there. Again, we are big on support groups. Increasing knowledge through education. Education is incredibly powerful. Ask for help when you need it. Again, this is not a sign of weakness. This is a sign of strength. Rediscover humor, laughter, and play. I don't know if anybody else saw this, but when we started to have issues with our economy, there was a lot of stories on the news about laughter groups, where a group of people would get together in a room and somebody would just start laughing. Not at anything in particular, just start laughing, and it's contagious, and pretty soon the entire room would be laughing. And at the end of this, after about a 20-minute period, everybody would go home feeling incredibly better. So get together with a group of friends and just start laughing. And set new goals. This is really important, and I would suggest actually writing them down, as corny as it may seem when you're doing it, but setting new goals and actually writing them down really brings those goals to fruition. So if anybody's kind of gone through this whole process and reached the acceptance stage, I would really love for it if you could share, how did you know that you were at this acceptance stage? What did you do to get there? Might be really helpful to some other people that are on the phone as well. Okay, so now we've gone through the stages. Let's talk about grief as a gift. Can we really think of grief as a healing gift? No one wants to journey down the path of a chronic illness. We all have hopes of taking a life road that's free of illness, free of challenges, but that's just not reality. Grief can be the path toward healing as it helps to resolve incomplete life goals and reveal new life paths. Some of the books that we utilize to put this particular presentation together, one of them actually has a quote in it that says, "Until we grieve a loss, we cannot move forward from unfinished business." So again, look at moving through these stages so that you can accept where you are and continue on in your life. The journey begins through the grieving process. And you'll go through this grieving process again and again and again. Chronic illness, losing somebody close to you, losing a job, all kinds of changes in life bring us through this grieving process. Okay, so then healing through hope. We may not be able to change our situation, but we can learn to manage it and use hope kind of as a catalyst to move us forward. Hope's the renewal that you can draw from. It allows each person to move into a more positive direction, allow us to examine our resources. It allows us to make realistic plans for living with the chronic illness. It gives life meaning, and it gives us a direction. There is absolutely a mind-body connection. That's been proven through research, that people that think positively just tend in general to be more positive. And again, another quote, and I'll share with you this book, and I've shared this with Amy, so she can definitely pass along the information, but it is on the slides as well. Kay Lewis is the author of this book entitled Attitudes for Living with Chronic Illness. It was actually published by the Arthritis Foundation. This woman has a PhD in all of this, but was actually diagnosed in the 80s with lupus before there were a lot of treatments for lupus. And in response to being diagnosed with this, she went through some other changes in her life that were real devastating as well. And she ended up writing this book, which is just very positive and was kind of the main source for putting together this slide deck. So I would encourage everyone, if you have an interest, to get this book and to read it. Okay, let's see if we can get to our summary here. Okay, so just kind of in summary of what we talked about, understanding and working through the stages of grief allows you to identify your losses, your limitations, to look at the emotions that you're going through and that chronic illness brings on you. Work through the stages of grief. Keep taking the steps forward. The biggest point being just recognize where you are in this process. And understand that positively coping with the grieving process and finding that healing quality, it brings you to acceptance. And then kind of the last quote, use the grieving process to find your comfort in healing. That's kind of the basis of the point. So with that, if anybody has any questions, or I'd love to hear even comments, ways that you've worked through stages, we will go ahead and do that.
That was really great, Megan. Thank you so much. It was a wonderful presentation. And, yes, we absolutely invite everybody to share your thoughts and have some questions. We do have one from Lisa. She's wondering about what's the best way to explain the disease and what she's going through to business associates. She's newly diagnosed.
That's a really good question. I would actually probably refer you to the Scleroderma Research Foundation or another organization that specifically deals with scleroderma. They have some really good kind of 1-2 sentence, informational lines that you can give to people. Any chronic disease, any rare chronic disease, I like to actually equate to cancer because everybody can kind of relate to cancer. Most people have some idea of what that is. They've maybe dealt with it themselves, have a loved one that has, or it's kind of a common situation that people are aware of. And I would let them know that this is just as serious as a cancer would be. The treatments are just as invasive and heavy. And that kind of just gives them a general idea of what you're dealing with. Because often people with cancer, the biggest, I think, frustration I hear is people will say, you look so good, I can't believe you're sick. Even, scleroderma, maybe you have gloves on in the grocery store. They just don't understand. And people that have cancer often look very good too, but there's a lot going on inside that is not okay. So just equating it to cancer can sometimes make it real simple for anybody that you're talking with.
Yeah, I think one of the things that we've experienced here too is where, you see somebody and you recognize that they might be having some struggles and they don't really want to talk about it, but I think the other person feels like they need to, and I'm not sure everybody knows how to deal with that either. Sometimes you just don't want to talk about it.
Yeah, absolutely.
We have a friend of the foundation, Karen, who, if you don't mind, we can unmute her and she can share some of her how she's dealt with her challenges.
Absolutely, that'd be great.
Hi, thanks for putting me on. My symptoms started in 92. I was diagnosed in 94. I've had it a while, and I can't agree enough that looking into therapy is really what helped me cope through the stages of grief. Looking at her list of the negative coping skills, I probably did them all, and finding an outlet that wasn't my family or my friends, someone who was not connected, seemed to help the most because I could really vent that frustration from, my feelings of loss. As a control freak, I don't know if anyone else is like that. It is a loss of control. And the other thing that I thought she mentioned was the big cry. I suppressed that for quite a while, and once I started having those, I had them less and less, and it just helped me let it out when I need it. I'm sorry. And another thing that helped was the journaling. There's different ways to journal, and I do write, but I also I'm not a very good artist, but I will sit down with a box of crayons and just draw to kind of keep my mind off of things, or write a letter to a symptom that's bothering me and tear it up and throw it in the garbage.
That is wonderful. That is a huge part actually of the journaling presentation that we do is coloring. We've even told people, go get coloring books. that speak to you, whether it's a princess coloring book or whatever it may be. And just sitting down and coloring is really therapeutic. And even if you're not an artist, even getting a blank piece of paper and just let your feelings flow, it may sound corny to some people, but you'd be amazed at what it gets out.
As someone who's done it, I agree. It really does just let that out, and doesn't necessarily take your mind off of it. Gives you some relief. Gives me some relief.
Megan, do you have any suggestions for people who do not have a support group locally or feel uncomfortable going to one?
You know, unfortunately, I'm not real familiar with anything in the scleroderma community that hooks patients together. I am in some other diseases. Actually, you know, even if you do not have this specific disease associated with your scleroderma, I would highly recommend going to this website. The Pulmonary Hypertension Association is a nonprofit organization, and patients with scleroderma have a higher likelihood than the general public of developing this disease. So there are a lot of people with scleroderma that are on this website, and they have some different chat rooms and blogging and things going on. You can hook up with a mentor and things like that, and there are definitely subgroups of patients that have scleroderma and pulmonary hypertension. But even if you don't have pulmonary hypertension, the website is phassociation.org. And you can go on there, look into finding the scleroderma-specific population and find someone to talk to that way. As far as a support group, I've actually helped a lot of people start support groups, and they're not as complicated as you would think. You can certainly, send out letters through doctors and, nurses' offices, ask them if they would send flyers out to their patients, which usually they're more than happy to do. Pick a location, whether it's a coffee shop or a library meeting room or a church fellowship community room of some sort, and plan a date and a time and send out the flyers and go and sit there. And sometimes if there's only one or two people who show up, sometimes nobody, and sometimes you get a room of 20. But just planning those initial meetings, it's very easy to get a support group together, and you'd be amazed how quickly they get up and going, and you've got other people that are understanding what you're going through to talk with on a regular basis.
Megan, if you don't mind, we have somebody who lost their mom recently to scleroderma that would also would like to have an opportunity to chat, if you don't mind.
Sure, absolutely.
Kay?
Hi, thank you very much. My mom had been sick for quite a while before, she was actually diagnosed, and we really didn't know too much about the disease. But once she started to undergo treatment, and we watched her go through the different phases. You talked about going to the supermarket with gloves on or being cold all the time. We really just kept thinking that she would get better with her treatment. But as it progressed, one of the things that her family members, my dad and my siblings and I had to come to grips with is that, part of it, we kept trying to encourage her to fight. And while that's true, they had gotten to a point where, her doctors had said there wasn't much they could do for her. And I think what helped my dad, my siblings, and I to help support my mom better is recognizing that it wasn't about her fighting because we wanted her to live. I mean, she wanted to live too, and we wanted her to live. But we had to get to a point where we acknowledged that she wasn't going to get better. And what was best was how can we best support her through her treatment with her doctors and just helping her to recognize when certain things became too much for her to handle. And I'll tell you that when we got to the point within the last year where we could truly help her fight and deal with the challenges of scleroderma, I think it made the last several months of her life, not necessarily easier, but, it helped us to support her better. It helped us to not fight and say, no, don't let her get these drugs or because she needed that for her comfort. So I think as family members and as support, when we as the family members truly accept that this may be inevitable, it allowed us to help support her so much better. And I will say that her nurses, her doctors, the hospital in the Bronx, New York, that helped her out at the end, they were tremendous. And it's a disease that's difficult to handle. And I'm still trying to deal with what we witness her go through. And the grief still goes on, even after they're gone, not just for their loss, but recognizing the challenges and the difficulties that they went through. It's something that I still am understanding, and that's why I wanted to come on this call to listen, because family members really need to understand it's about the patient, it's about your loved one, and how you can best help them cope with what they're going through, because it was really, really difficult for her, and it was tough to watch.
Well, thank you so much for sharing, and I just want to congratulate you on fully accepting where she was, because that's very difficult. Challenges I think that we deal with is helping the family to come alongside the patient when you do get towards the end of this disease, because sometimes the wishes are different, as you kind of just described a little bit. But thank you for sharing that. I think that's really important for other people to hear and to be able to kind of understand that they're not the only ones dealing with these kind of situations.
Megan, if you still have some time, we'd love – Kelly is another patient that would like to share, if you're okay with that.
Absolutely.
Hi, Megan. Thank you for taking the time to do this, and thanks to the Scleroderma Research Foundation for doing the webinar as well. I was diagnosed with scleroderma in 2007, and I was 36. I was in my mid-30s. So I went through all of those different stages of denial, being angry. I was very successful in corporate America, so I felt a huge sense of loss because I lost my independence and ability to do things for myself and not able to work, and loss of income, and having to deal with being on disability. So it was a struggle in the first couple of years of just acceptance that this had happened to me and trying to understand why and finding purpose in that and understanding why would this happen to me. I'm going along with life, and doing okay and had all of these plans. So what helped me, like one of the things you said, was to educate myself as much as possible about the disease and finding that doctors weren't as educated as I thought that they would be, but understanding that it was rare and they didn't deal with it a lot. So doing a lot of research on my own to understand. And then what helped me, and everyone's different, but what helped me was my spiritual life. So I prayed a lot and depended on my church family for support through prayer to help me just in not just accepting the disease in a way of just saying, oh, this is just my life and give into it, but more what you said in terms of taking control of the situation. And so I had support from my family and friends, and also part of my purpose was starting to help others with scleroderma gave me a sense of purpose and understanding, well, does God have a bigger purpose for me, and the fact that I'm challenged with this and my belief in that everything happens for a reason. So for me, prayer and my spirituality was huge in getting to the stage that I am now. It's that making my life better and taking control and feeling empowered, and so now reaching back and helping other people to deal with the situation as well.
Oh, thank you, Kelly. I appreciate you sharing that, and I'll say that a lot of strong, positive people that end up with a lot of different chronic diseases I've experienced become leaders in their disease community world, taking on leadership, helping others that are going through this to deal with their situations, becoming support group leaders, and so on and so forth. So thank you for people like you who are able to take an incredibly difficult time in their own personal lives and share with other people. We had a question as well about, is it normal to go back and forth through the 5 stages that we talked about? It absolutely is. Just as this disease is incredibly individualized, how you go through the grieving process is individualized, and no two people will go through it the same. at the same speed, in the same order, so on and so forth. So yes, it is absolutely normal. It doesn't mean that there's anything strange about you if you, start in the depression stage and then all of a sudden you're in acceptance and then you're denying it a month later. So yes, that is absolutely something that we expect.
So if there was a single piece of advice that you could give to a patient, what do you think the best piece of advice that you could give to them?
You are the best advocate. You're the best advocate for yourself when you're in the doctor's office as far as, what treatments you want to take and what therapies you want to be involved with. You're also the best advocate for knowing your mind and your emotions. So you are the one that's going to best be able to recognize where you are in this process. And if you've reached acceptance and maybe you've had a change with your condition and you can sense yourself falling back, I would advise you to be very cognizant of where you are, to always keep that in mind, because when you recognize where you are, it's much easier to remain positive and to cope positively with the stage that you're in. Mm-hmm.
Thank you so much, Megan. This was a really great session, and we really appreciate your time. It looks like we're just getting ready to wrap up, and so if you, I don't see any other additional questions here. So I truly want to thank you for your time today. This was really fantastic. And we know that the scleroderma community is growing, and we're all part of it. So I'd love to keep the conversation going. So when you close the window, after we're done with our time here today, if you could provide us with some valuable feedback by taking our short survey that we have at the end and sharing your thoughts about this webinar. And if you'd like to see more like it, you can also email us via our website where we have a lot more information available. Do you have any closing comments, Megan, that you'd like to add?
No, I appreciate the opportunity, and, just keep moving forward. You can do it.
Absolutely, absolutely. In closing, I wanted to announce our next webinar. We will be welcoming Dr. Roham Zamanian. He's the director of the Adult Pulmonary Hypertension Clinical Service at Stanford University, and he's going to present pulmonary hypertension as a complication of scleroderma, and it's a guide for patients and caregivers. And that'll be on Tuesday, October 30th at 11 a.m. Pacific time, and I hope you guys can save the date and register online and join us. And, just in closing, please remember that we depend on your support to continue our investment in the most promising research, and so visit us online at www.sclerodermaresearch.org or call our offices at 1-800-441-CURE. That's 1-800-441-2873. And unless we have any more questions, I think we're going to wrap it up for today.